Welcome back to Sleep Better TV. My guest is Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. He's a dentist who also treats sleep breathing disorders in TMJ. Dr. Pribyl, welcome back. How is apnea classified?
Well, severity of sleep apnea is given a grade in regard to the number of events that we stop breathing each night, and that's called your AHI, Apnea Hypopnea Index. And when you stop breathing for 10 seconds or more, that's classifies as an event. So anything less than 5 events an hour is classified as no apnea at all. When you have 5 to 15 events an hour, that's classified as mild. 15 to 30 events is classified as moderate, and anything more than 30 events is classified as severe apnea when you're dealing with an adult. And in regard to those issues, it can be 10 seconds, it has to be a minimum, but it can also be 20, 30, 60, it can be a long time. And so that has a varying impact on our vital organs, on our brain, our heart. They don't react positively to lacking oxygen.
So comparing adults and children, are the numbers the same for both adults and kids?
For children, if a child has an apnea event, 1, that is classified as needing to be treated. 1 event for a child is a serious issue. And there are some children, 10 events, 20 events an hour are very threatening to them. And if a child is not getting into good sleep, they're not producing growth hormone, they need that for their future, and that can deprive them of the necessary things they need. So a good night's sleep, your mom used to tell you, it's very important, and it's extremely important for each one of us.
So do you think children need a sleep study to diagnose their apnea, or can the apnea be actually diagnosed by observation?
A sleep study is the gold standard when it comes to diagnosing sleep apnea. Most patients that go to a sleep lab for an evaluation, most kids, it's an observed thing first. A parent will notice their child stopping breathing and move on down through the healthcare chain to get things taken care of. But it's something that needs to be diagnosed properly by way of a polysomnograph test in the sleep lab.
Finally, Dr. Pribyl, does apnea carry the same health risks with adults and children?
The risks are a little more severe in a way when you talk about a growing child that needs their oxygen through the course of a night. A child that has sleep apnea, there are strong relationships between that and kids who have ADHD, kids who bedwet. So there are things that children experience. They don't experience a lot of the daytime sleepiness that adults do. Sleep apnea can manifest itself differently with kids than it does with adults. Adults will fall asleep. We may fall asleep at a stoplight. We may fall asleep watching TV. And kids have a tendency to get wired and go like no other.
Dr. Larry Pribyl is my guest. He practices at the Center for TMJ and Sleep Apnea in Independence, Missouri. Doctor, thank you so much.
Thank you.
I'm Scott Drake. This is Sleep Better TV.